in the next few minutes, we will discuss about the role of different food component or nutrients and their effect in our body. So, for example, what is the role of carbohydrate? What is the role of different types of proteins? What is the role of lipids? Right? So, sometimes they even ask this kind of question. Role of different proteins in health and nutrition. Right? Then lipid itself is a very big subject. There are a lot of things comes. Okay? In health as well as in pathology. So there also it is important. You might expect MCQs, you might expect short questions from this chapter. Definitely one or two short questions will be there. So among the carbohydrates are the major source of energy in a diet for us, for Indians, correct? Those who produce plenty of carbohydrate containing food like rice, dal, etc. So we consume those and we get most of our energy from the carbohydrate. If that is not available, then we can fulfill the energy requirement by carbohydrate by using or consuming sugar, plain table sugar. How much sugar do you consume every day? With a cup of tea, cup of coffee, Horlicks, milk, ice cream, candies, wafers. So we consume a lot of sugar. So these sugars are of two types. One which produce energy and the one which does not produce energy. The sugars which does not produce energy are called resistant sugars or resistant starch. Right? So these compounds are called dietary fibers. These compounds are called dietary fiber. Resistant starch are of many types, different classification. Type 1, type 2, type 3, depending on how much energy are derived from them. That classification is not required here. But for the time being, we must remember the role of dietary fiber in normal health. What is the role of dietary fiber? Roughage, very good, that's a good answer. Anything else? Inhibits cholesterol, helps in or prevents the absorption of cholesterol. Tibal. Colon cancer, very good. It prevents colon cancer. Why? Colon cancer, one of the cause for colon cancer is deposition of heavy metal in the colon. Deposition of heavy metal in the colon. What are these heavy metals? কি বললাম লাইনটা কি বললাম কোলন ক্যান্সারের একটা অন্যতম কারণ হচ্ছে হেভি মেটালের ডিপোজিশন ইন কোলন হেভি মেটালের এক্সাম্পল দাও lead, cadmium, correct? কোথায় পাওয়া যায় সোর্স where do you throw your used battery cell power cells where do you throw it everywhere near you so you get it from the vegetables the fish anything which utilizes the water which is contaminated by the cadmium from the battery from the cell thrown by you. If you make a mess of the thing, who has to pay? You. If not, your next generation. Another source of cadmium is a fermented product, beer. How many of Indians consume 2 liters of beer per day? Any idea? Very less. Very less. Correct? Where 80% of the population is still fed by rationing, free ration, there is no question that they can drink more than 2 liters of beer per day. People, countries where beer consumption is high, it has been found that they suffer from more colon cancer. Right? Why? Because their diet severely lacking dietary fiber. We Indians are lucky, our food habits contains a lot of vegetables. By knowingly, unknowingly, willingly or unwillingly, we have to consume some amount of dietary fiber, and that prevents us, saves us from colon cancer. Moreover, our drinking habit is not like US or UK. That's a plus point which help us to prevent colon cancer. Right? These dietary fibers, they produce a lot of roughage. While clearing the gut, it carries the heavy metals along with it. So heavy metals cannot get accumulated in the gut or large intestine or colon. Right? Dietary fibers, by this, prevent colon cancer in a large, in a very, very significant way. Number two, dietary fibers, they reduce the absorption of cholesterol or fat from the gut. They also reduce the absorption of iron, calcium. That is a plus minus point, drawback, right? Again, dietary fibers, they prevent constipation by accumulating stool. They form the stool which is soft so that it can be cleared off easily. Yes, the dietary fiber swells up with water and it gives us a feeling of fullness in the stomach. That triggers the satiety center of the brain and we stop eating. So the people like me who are highly obese, they are very often prescribed to have dietary fibers or resistant starch, which fills up the stomach but provides very low energy. So it's a prescription for people who are suffering from constipation. It's a prescription for people who are obese to manage the energy consumption, and it's a prescription for diabetics. How? The resistant starch has very low glycemic index. What is glycemic index? The amount of surge, glucose surge in the blood compared to same amount of glucose after consumption. How much glucose surge is present? Because higher the glucose surge, higher the insulin secretion. Higher the insulin secretion, what happens? More craving for food. But in diabetes, there is no insulin or there is insulin resistance. In both the cases, the glycemic level remains high, which causes damage. Correct? So resistant starch or dietary fiber also plays an important role in lowering the glycemic index. So these 4 points you must remember from the dietary fiber. Okay? There are many other points like dilution of toxins and all, that also you can mention. Some examples of dietary fiber. You need not to write, just remember some names. That's all. Cellulose, hemicellulose, lignin, pectins. Very good. It has got bile acid sequestering effect. Bile acid sequestering effect. মনে রাখতে হবে, এগুলো পরীক্ষা আসে। Bile acid sequestering agent. একটা example দাও। Example দে, bile acid sequestering agent. Cholestyramine, cholesterol. Lipids can be divided in two parts physically. Visible fat and invisible fat. What is visible fat? So subcutaneous fat. Chubby cheek, bumpy abdomen. All these are visible fat. What is invisible fat? The invisible fat is actually present in our body, covering the inner organs. It is present in the lining of the tissues. Correct? And this is more important. Okay. Now these two fats can be generated. Either we can consume direct fat from ghee, butter, etc., or we can synthesize the same by eating more and more carbohydrate. Bosho, more and more carbohydrate. So when we take ghee, butter, etc., this fat is seen that we are eating fat or the animal fat in the form of oil. So that goes and gets stored in our body. Whereas if we just take plenty of rice every day, 3-4 times, then also will become fat. Why? Because that carbohydrate will synthesize fat inside our body. We are not consuming fat, but it is being synthesized from the carbohydrate. So carbohydrate can synthesize not only fat, it can also synthesize protein. That is why poor people in India can survive for such a long time without having good protein or good lipid in their diet. Now the fat or fatty acid can be of many types, essential and non-essential. If I ask you, what are essential fatty acids? What is your answer? It's a very crucial question. The answer will change as you will grow up. When you are in class 8, the answer was 3. When you are in first year, answer is 2. When you are in final year, answer is 1. Confusing? Yeah? Answer is 1. So now suppose you are in first year. Let us discuss from the 8th standard. 8th standard you knew there were 3. Alpha, linoleic, linolenic and arachidonic acid. In the first year of MBBS you will learn 2. Alpha, linoleic and linolenic. When you pronounce like this, there is no chance that you do a spelling mistake. Linoleic and linolenic. Correct? Now these gamma linolenic can be synthesized in the body. So part of linolenic can be synthesized in the body. Dihomo gamma linolenic acid. So what is left? Only alpha linoleic acid. It cannot be synthesized in our body because of enzyme, deficiency of enzyme delta 4 desaturases. Because of deficiency of enzyme delta 4 desaturases. Okay. So ideally there is only one essential fatty acid. Okay. But if they ask you in first year, name the essential fatty acid, you must tell at least 2. And if you mention with proper reason, explanation that why you are considering only alpha linoleic acid as only essential acid, then you have to give the explanation. Fine and good. Huh? Now, what is trans fatty acid or trans fat? Trans fat is a triglyceride which contain trans fatty acid. The saturated fatty acid is harmful. It causes CAD, coronary artery disease. The trans fatty acid is not saturated, it is unsaturated, but in trans form. It is equally harmful as saturated fatty acid. It is equally harmful as saturated fatty acid. So trans fat should be avoided, as we must avoid saturated fatty acid. Fine. Trans fat reduces the freezing point. That means it will become solid at body temperature. It will get stuck in the blood vessel. Correct? And once a trans fat is introduced in our body, it takes many years to get rid of it. It is very, very difficult. The trans fat is usually found in tasty fried foods outside. Suppose you are taking an egg roll and you have consumed, say, 5 grams of trans fat. It will take 20 years to get rid of that 5 grams of trans fat from your body. Now imagine how many egg rolls you have taken already. Correct? So that is the difficulty with trans fat. Correct? Trans fat should be avoided because of this. Regarding PUFA, what is the alternative for trans fat? In oil industry, the alternative for trans fat is MUFA. Alternative of trans fat is MUFA, cis form in oil industry. Correct? Achha, what is PUFA? PUFA must be having more than one double bond. And again, this PUFA in cis form it is good, in trans form it is as bad as trans fat. This linoleic, linolenic, arachidonic, these are all cis fatty acid. They are not trans. If they become trans, they are no way, anyway useful. Omega-3 series, omega-6 series, omega-9 series are the different series for PUFA. Now, PUFA is very good for heart, no doubt. It has high turnover number means very short half-life in our body. It is readily metabolized. Everything it is required for synthesis of many biomolecules. Everything is good. But consumption of more and more PUFA in a particular way is harmful. The way Indians cook. We do not add oil as a seasoning. We fry in the oil. We boil the oil at temperature more than 300 degrees. And then we fry one beguni and one puri or samosa or fish fry. The fish contains good oil, but the oil in which fish is fried has become now no trans. PUFA, if it is PUFA rich, it will break and it will form MDA. The MDA will cause cancer. The good oil in the fish will prevent you from dying CAD, but you will die from cancer. It will increase the oxidative stress. So you choose which one you want to die from, CAD or cancer. Which one you want to die for? See, that is going to happen one day. That is inevitable. You may not get chicken in chicken biryani, but you will definitely get death. Right? So, the people of India had to choose one of them. Then the government of India chose, okay, let them die from CAD. Let us withdraw the PUFA content, lower the PUFA content in the oil. Hence, introduction of MUFA became more prevalent in the cooking oils. In some oils, they are PUFA rich, they cannot be used for frying purposes or making curries at high temperature like olive oil. Okay. We come to protein. Proteins are of two types, first class protein and second class protein. First class proteins are those which contain all the essential amino acids in required proportion. Okay, in required proportion, which is must for sustenance of the normal health and physiology. Fine. Second class proteins are mostly those who are deficient of one or two. Right? There is no third class dibba, so you have to purchase either first or second. Protein requirement per day. Don't try it. Just see how much protein do we actually require. How much protein you require? Which age group you are in? On an average, as per the Indian Railway, 180 grams of meat is served. 140 to 180 grams of meat or chicken is served in one serving. What is your body weight? Find out how much protein is there. Suppose 100 grams of chicken you have taken. Right? If your body weight is 70 kilo, how much do you require? Or your body weight is 100 kilo for ease of the calculation. How much? 80 grams? Out of 100 grams of chicken, how much is protein? 10% you remove SDA, it becomes 90. Out of 90, 60% protein, 40% some other stuff. The curry is there, spices, oil, everything, salt, remove that. Protein is just 60% only. How much protein you are getting? Less than the half you require. Less than half you require. So how much protein you must take? If you are 100 kilo, then you must take how much? At least 300 grams. Right? Then you will get around whatever protein requirement in the body. Do we eat like that normally? Indians? No. That's why see. Huh? Getting thin but not healthy. That's why. So protein requirement is always being a challenge for public health in India. How to supply protein at cheap cost, cheapest way. The cheapest way of having protein is egg, definitely, nothing else. Now, nitrogen balance. Here, this part you must remember. I means dietary intake, U loss through urine, F loss through feces, and S loss through exfoliation of the skin. So how much a normal healthy adult is said to be nitrogen balance? When these two are equal, the left hand side and right hand side, we are in perfect nitrogen balance. If left hand side is less than right hand side, we are in negative nitrogen balance. So we might lose weight. Not sure, not always, always no, not always we lose weight. Because we might gain the weight by accumulating fat, but not protein. So the negative nitrogen balance may lead to weight loss. Loss of, rather, more precisely, loss of muscle mass. I give you one example. Now you are in the age of 18 to 20 range. You just go and ask your mom at your age, was she able to run and catch a running bus? She would say yes. Ask her to do the same. Most of them will fail. Why? Because of lack of muscle mass. They may not have gained weight from that period to this period, but their muscle mass has reduced. So the exercise, weight exercise or weight bearing exercise is necessary to trigger the muscle or work out the muscle so that muscle can gain the weight. And it is necessary to keep the body healthy and keep the strength of the body intact. Most of the people who are at your mom's age or dad's age, they are unable to climb steps. They say like they are getting tired. Why? because of lack of muscle power, nothing else. As they grow up, we grow up in India, we have a habit of removing protein from our diet. We go for more vegetarians. That is a wrong notion actually. We must take, it is lost least amount, but we must take. So positive balance means when you have I greater than UFS. When we have this at growing age. At growing age. At old age, usually I is less than UFS. Left hand side is less than right hand side. This is a diagram which shows the utilization of amino acid in the body, from where they come and from where they are used for. Right? They come from diet, they come from breakdown of body protein. The same can be synthesized from this using the amino acid pool. They can be lost through the layoff of skin cells and through urine nitrogen product and feces. Correct? Why feces? Tell me. Feces means what? What is undigested, what is unused. So that is not ingested. Why you are counting the protein loss through feces? Because although it contains most of the what are undigested, but it also contains some of the exfoliated internal cells. So that is also part of protein loss. Factors affecting nitrogen balance. Please take a quick note of the headings. That's all. Okay. Just quick points. Growth, hormones, pregnancy and convalescence. Convalescence means? Anyone? The period when he is recovering from surgery or heavy illness, severe illness. Acute illness, negative chronic illness, negative protein deficiency in diet. লেখা আছে সবকটা না রিপিট করে দেখাবো একবার লিখেছো সবাই লিখেছো all the points you have written just write the points, that's all. Detailing not required. Assessment of nutritional values. There are certain indices which are used to assess the nutritional value as per the protein is concerned in the individual. One of them is biological value of the protein. Another is NPU, net protein utilization of the protein. But another is the chemical score is also there. Chemical score that is for protein. But these are two for our nutrition part. These are called health indices for protein metabolism. আমার শরীরে প্রোটিন মেটাবলিজম কি ফর্মে আছে তারটা ইন্ডেক্স বা সূচক, তাই না? Biological value. It is a ratio between the amount of nitrogen retained and amount of nitrogen absorbed during a specific interval. কতটা অ্যাবজর্ব করেছে নাইট্রোজেন, কতটা বডি রিটেইন করেছে, পার্সেন্টেজে বার করা হয়। NPU, net protein utilization. রিটেইন নাইট্রোজেন এইটা বাই ইনটেক অফ নাইট্রোজেন, এটা নয় যেটা খাওয়া হয়েছে। Intake of nitrogen, I minus F becomes I minus F lost by feces becomes absorbed nitrogen. তাহলে retained nitrogen, intake of nitrogen by into 100. Ultimately কতটা ইউটিলাইজ হলো? আমি খেলাম 100 গ্রাম প্রোটিন, কিন্তু আমার শরীরে কতটা প্রোটিন ইউটিলাইজেশন হলো কি করে বুঝবো? বাই মেজারিং দ্য মাসেল মাস, ওয়েদার আই এম গ্রোয়িং অর নট, মানে মাসেল মাস ইজ গ্রোয়িং অর নট। কারেক্ট? নেট প্রোটিন ইউটিলাইজেশন বুঝে গেল। বায়োলজিক্যাল ভ্যালু মানে কি হবে? Suppose there are 5 proteins from 5 different sources. Which protein is good for the individual? How do you know? Which protein will be absorbed faster, will be retained? That will be given by this index. Okay? It will help us to determine the type of or quality of the protein to be prescribed for easy digestion and absorption. What do you mean limiting amino acid? Limiting amino acid মানে হচ্ছে there are few proteins which lack 1 or 2 amino acids. Those particular amino acids is called limiting amino acid. How to assess a protein based on the limiting amino acid? How to assess which protein is better? There is an index called chemical score of the protein. Chemical score of the protein. It must be referred with a reference protein, that is albumin. So you take albumin, the biological value or NPU of albumin, and the biological value or NPU of the protein under test. You get the chemical score, which amino acid is actually absent. And due to absence of that amino acid, how far the protein utilization or biological value is being affected. It may not affect, it may affect. How do you know? So these are the indices used to assess the effect of missing any of the essential amino acid. That index is called chemical score of the protein. Now these two diagrams, you see, weight of the animal increasing means positive nitrogen balance when zein, tryptophan and lysine is given. Zein is a protein from maize, bhutta, corn. Zein is lacking tryptophan and lysine. Tryptophan and lysine. These two are essential amino acid. When a test animal were fed with only zein, the weight started decreasing. When they are fed with zein and lysine, slightly increased, better. When they are fed with zein and tryptophan, further better. When they are fed with zein plus both, giving maximal results. Okay? Now, in protein from maize, these two amino acids are missing. If we give some protein which contains these amino acid, then what will happen? That protein will supplement this second class protein. Right? This effect of food is called mutual supplementation. Exactly what happens with rice and dal, chapati and dal. Few amino acids are missing in chapati protein, few amino acids are missing in the dal. They mutually supplement each other. It's called mutual supplementation of the food. Just know these terms. It is necessary. Sometimes they will ask simple questions as simple as these terms. Last year it happened. I told you. BMI they asked. Nonsense people have written. It may be very easy, we might have heard many times these things. But please be careful. This class is important because you will just brush up whatever you have heard, whatever you know, and we know with proper reasons. Okay, here are some proteins showing this thing. Tapioca is a food. Anyone from Kerala here? Anyone from Kerala? It is found in Kerala. Like কি বলে like I am কচুর মতন দেখতে একটা হয়, হ্যাঁ, গলা চুলকায় না আর কি। সেটা একটা প্রোডাক্ট, টিউবার আর কি, it's a tuber. So they eat it along with meat, fish, whatever they cook, they have it. You Kerala na? You're from Kerala? Oh, you dressed like Kerala, na? That day? See. So tapioca is that. Bengal gram, commonly we take chola, that doesn't contain cysteine and methionine. Anyway, এটা পড়াবো না কারণ এটা তোমাদের অলরেডি পড়ানো হয়ে গেছে, কশেকর ম্যারাসমাস, তাই তো? ওবেসিটি অ্যান্ড বিএমআই, এখানে কিছু মিথস গুলো আমি বলে দিই। What is your opinion? এদিকে একটা কলম আছে বিএমআই, এখানে নিউট্রিশনাল স্ট্যাটাস মানে হেলদি, ম্যাল নিউট্রিশন, ওভার নিউট্রিশন, বোঝা যাবে বিএমআই দিয়ে? বিএমআই কি? ফ্যাট লোক, তাই তো? ঠিক আছে, দু রকম ওবেসিটি আছে এখানে, তাই না? কি অ্যাপেল শেপের, আর এটা পেয়ারা মতন পিয়ার শেপের নাশপাতি, তাই না? এই দু ধরনের ওবেস লোক পাওয়া যায়, ঠিক আছে? BMI does not tell about nutritional status. It is neither gender specific nor age specific. And definitely it is not the only index by which we measure the obesity. Right? The calculation of BMI is very simple. If you see, weight in kg, height square in meters, আর যদি তুমি ওই ব্রিটিশ মিটারে যাও তাহলে পাউন্ড বাই ইঞ্চ স্কোয়ার। তাহলে এখানে এজ কোথায় আছে, জেন্ডার কোথায় আছে, তাই না? তাহলে আমরা কি করে বলি, হাউ ডু আই ডিসাইড what is a normal BMI for up to 16 years of age, up to 18 years of age, up to 25, up to 30, up to 40, beyond 60? We have done a population study and found that normally healthy looking persons are having BMI between these two regions. Problem is, if you are between 18.5 to 24.9, this range, you are neither obese nor lean, underweight, you are normal. Correct? But what is missing here? টম ক্রুজ, তারপরে কি বলে যে গুলি করে হিরোটা, কি নাম, ভ্যান ডাম, আর্নল্ড শোয়ার্জনেগার আর আমি এক হলো, তাই না? ক্যাটরিন জিটা জোন্স আর ও এক হলো, হ্যাঁ? ড্রু ব্যারিমোর বা ও এক হলো, এটা বলা নেই। ইউজুয়ালি ইউরোপিয়ানদের স্ট্রাকচার আমার থেকে বড় হয়, বিকজ তারা ছোট থেকে প্রোটিন বেশি খায়, আমরা প্রোটিন কম খাই। তারপর একটা গ্রুপ, একটা এথনিসিটি গ্রুপের তফাৎ আছে। সেই জন্য ফর ইন্ডিয়ান ইট ইজ 23.5 only for Indians ধরা হয়, ঠিক আছে? This is for male. So দেখো, it is not gender specific, but this is for male. ফিমেলের 2 করে কমিয়ে দাও, 2 করে কমিয়ে দাও, তাই হবে। Male এরকম average Indian male must be within 23.5 if he or he has to be normal weight. Then what does BMI actually shows up? The BMI gives a easiest way to find out any person in a given population whether he is overweight or underweight. This is the easiest way, but it's not the ultimate index. What are the other indices that fulfill the deficiencies in BMI? That we have to know. Yeah. A person will be called obese if all these parameters fall in obese range. But for a person which is obviously looking very obese, like me, for me you need not to do other things, only BMI is sufficient. But for person, come out. So alone BMI is not helpful here. You tell me, who is underweight? Alone BMI is not useful here. But you tell me, who is obese? Need not to calculate BMI. Konta? Do I look like apple or pear? Bolo? Pear. Indians are pear shaped. Americans are, so the person when obviously he is obese, you can make out by seeing the BMI is sufficient. But between people who are very confusing, you don't know, then alone BMI is not helpful. 50 grams glucose খাওয়ানো হয়, তার 2 ঘন্টা পরে ব্লাড গ্লুকোজ মাপা হয়। 50 grams যে খাবারটা খাবে, আটা হতে পারে, ময়দা হতে পারে, চকলেট হতে পারে, মাছ হতে পারে, মাংস হতে পারে, খাওয়াবে, ডাল হতে পারে, 50 গ্রাম খাওয়াবে, খাওয়ানোর 2 ঘন্টা পরে ব্লাড গ্লুকোজ মাপবে। যার বেশি হবে, যে ভ্যালুগুলো আসবে সেটা দিয়ে ভাগ করলে টোটাল এরিয়ার একটা এরিয়া আসে, সেই এরিয়া টোটাল এরিয়াকে ভাগ করলে যে রেশিও পাওয়া যাবে তাকে 100 দিয়ে গুণ করলে গ্লাইসেমিক ইন্ডেক্স পাওয়া যায়। এতে কি বোঝা যায়? হাউ মাচ ব্লাড গ্লুকোজ দ্যাট পার্টিকুলার টেস্ট মিল ইনক্রিজেস উইথ রেসপেক্ট টু দ্যাট অফ দি রেফারেন্স মিল। কি বললাম? How much blood glucose of a particular test meal increases within an individual with reference to that of the same amount of reference meal. Reference meal কি? 50 grams of glucose. Glucose tolerance কত দেওয়া হয়? 75 grams of glucose. এখানে কত দেওয়া হচ্ছে? 50 গ্রাম দেওয়া হচ্ছে। গ্লুকোজ টলারেন্স আরেকটা কি আছে? বেশি গ্লুকোজ কম হয়, 100 গ্রাম গ্লুকোজ খাওয়ানো হয়। Glucose load test 100 grams of glucose, glucose tolerance test 75 grams of glucose, glycemic index 50 grams of glucose। এইটুকু লিখলে 3 নম্বর আসছিল এবার পরীক্ষায়, কেউ লিখতে পারেনি। ডেফিনেটলি একটা কোশ্চেন আসবে এখান থেকে, আসবেই আসবে।